Hello and welcome to another TLDR EU video. This year has certainly been an extremely rocky one for countries around the globe. Because when a pandemic hits your shores, there's no set path to take. Different countries around the globe took wildly different approaches to responding to the coronavirus when it first hit nearly a year ago, and in the subsequent waves. While many countries locked down hard, Sweden was and remains the prototypical example of a country that never fully locked down, a country whose approach we've discussed twice before on this channel. The issue now being that Sweden's king has admitted that the country's approach has failed. So in this video we're going to take another look at Sweden and their no lockdown policy, and what exactly the king has had to say about it. If you didn't know, we have a whole bunch of pin badges on our store featuring our countries with shoes design, and now we have one for every single EU country, as well as a bunch of others. If you want to support the channel and pick up a high quality enamel pin, you can head over to the store now, it's linked down below. And if you use code SWEDEN, you can get 10% off your order. For those of you who haven't watched our previous videos on Sweden, let's quickly recap exactly how they responded to the virus. Sweden, at the beginning of the pandemic, actually moved quite quickly. On the 1st of February, it formally declared COVID as a disease that constitutes a danger to society, bringing in certain aims and objectives for government policy in the aftermath. Despite this early concern though, they didn't implement the strong suppression and lockdown strategies of other countries. Sweden chose a third way. There was no lockdown, no extensive system of contact tracing, and most restaurants, bars and primary schools remained open during the beginning of the pandemic. They did, however, close secondary schools and ban gatherings of more than 50 people. In justifying this light touch approach, Johan Carlsson, the head of Sweden's public health agency, stressed that Sweden simply cannot take draconian measures that have a limited impact on the epidemic but knock out the functions of society. Carlsson and his agency are actually one of the reasons behind this more unusual anti-lockdown approach. In Sweden, their health agency runs health separately from the government, allowing them to make scientific and health decisions without having to worry about the politics. State epidemiologist Anders Tegnell was actually one of the key figures behind this science-led approach, with him becoming somewhat of a rallying figure in Sweden, coming to embody a rational approach, as other countries appeared to sacrifice science to emotion. At the height of the first wave, Tegnell, talking to the Financial Times, seemed to suggest that Sweden was undergoing this light touch approach to mitigate the need for more restrictive measures in a future second wave, with him saying that in the autumn there will be a second wave. Sweden will have a high level of immunity and the number of cases will probably be quite low. But Finland will have a very low level of immunity. Will Finland have to go into a complete lockdown again? But it wasn't universally popular, with the approach condemned by many, following projections from a model developed by Imperial College London, which predicted some 85,000 deaths as a result of the light touch strategy. The thing was that at one point, Sweden's approach did seem to be working. Back in September, Financial Times analysis showed that Sweden was actually doing extremely well on the European scale. At the time, the 7-day rolling average of new confirmed cases in Spain stood at over 180 cases per million. In France, 100 cases per million. In the EU as a whole, 50 cases per million. In the UK, in the region of 30 per million. But in Sweden, it was only 10 cases per million, with Sweden being, again at the time, the only country with declining case rates. This was again something supported by data from the European Centre for Disease Prevention and Control, with their September survey of 31 countries finding that 22 had higher infection rates than Sweden, with Sweden's positivity rate standing at just 1.2%, the lowest since the pandemic began. That, however, is all in the past, and as things stand now, Sweden has recorded over 367,120 cases, and just under 8,000 deaths. For context, Sweden, which has half the population, has recorded under a tenth of their cases, at 33,000, and just over 6% of the deaths, at only 489. In Denmark, which again has about half the population of Sweden, cases stand at well less than half of Sweden's, 135,000, and deaths at an eighth, at about 1,000. So it seems that something's going wrong with Sweden's approach, with neighbouring countries faring far better following their more substantial lockdowns and restrictions. In his annual Christmas address, the Swedish king told Swedes that the country had suffered enormously in difficult conditions, and that "I think we failed. We have a large number who have died, and that is terrible. It's something that we all have to suffer with. Of course, the fact that so many have died can't be considered anything other than a failure. However, it's when we're through the pandemic that real conclusions can be drawn." This is a major change in precedent, given the largely ceremonial powers vested in the king, and the fact that the monarchy does not typically comment on political issues. When questioned by AFP, the Swedish royal court stressed that the remarks should not be taken as a comment on the strategy and were unpolitical, with the head of information at the court stressing the king is referring to the whole of Sweden and the whole of society. What the king is doing is showing empathy for all of those affected in different ways, and also those who have died in the pandemic. So now the Independent Health Agency was put in a tricky spot, for the first time really seeing outsiders attempting to control the country's policies. However, things got yet worse for them, as in the aftermath of the king's comments, with the Swedish Prime Minister announcing a wide set of measures, ranging from the first ever recommendation to wear face masks on public transport during rush hour, to the restriction of group meeting sizes down to just 4. Beyond that, the Prime Minister announced that the serving of alcohol will be prohibited after 8 p.m, and that non-essential workers should work from home for a month. He did, however, resist moving towards a full lockdown, laying down the gauntlet at the feet of shop owners, stressing that while they won't be shut now, if shopping centres, stores and gyms ignored the restrictions and hygiene measures, they would be closed down. In effect, laying the groundwork for a full lockdown type move, something contrary to Tegnell's comments just a few months ago. And that does make sense, because Finland and Norway have both recorded about 100 deaths in the past month, with about half of Sweden's population each. Sweden, however, has reported in excess of 1,700 deaths. Towards the end of November, in just 9 days, Sweden reported 397 COVID deaths. At the time, more than either Norway or Finland had announced during the entire pandemic. It's these stark and sad figures that spurred the Prime Minister to, in effect, take over the public-facing response to the crisis, with the Prime Minister's televised address being only the 4th ever televised address by a Swedish Prime Minister. And this led Nicholas I. Lott, an associate professor of political science at Södertörn University, to say that it's a mess now. It's a real mess. It's a mess because it's unclear who's really calling the shots. It's clear there's division between the government and the Public Health Agency. But the domestic criticism of Sweden's approach doesn't even stop there. A preliminary report by Sweden's Independent Coronavirus Commission, one of the first to publicise its findings, makes for some stark reading. The Commission's overarching assessment can be simply summed up as follows. Apart from the general spread of the virus in society, the factor that had the greatest impact on the number of cases of illness and deaths from COVID-19 in Swedish residential care is structural shortcomings that have been well known for a long time. Residential care was unprepared and ill-equipped to handle a pandemic. Staff were largely left to themselves to tackle the crisis. The report notes that of all infected care home residents, 20% were not seen by a doctor whatsoever, and 40% weren't even assessed by a nurse. The report is also blindingly clear when it comes to where the responsibility for these failings lies. The ultimate responsibility for these shortcomings rests with the government in power. The government governs the realm and should therefore take the necessary initiatives. So it seems like the scientists' approach is no longer working. While the Swedish Health Agency may have been confident and their initial results looked positive, this winter has been tough for the country so far, resulting in them seeing major spikes and leading cases in the region. It seems that some are fed up of the health agency's approach, with other people and politicians trying to wrestle control and fight the virus in the country. But what do you think? Is the king right? Has Sweden failed in its response to COVID? Or were they right to bring in light touch restrictions as a more long-term measure? As always, let us know what you think in the comments below. Be sure to subscribe to the channel and hit the bell icon to be notified every time we release a new video. Special thanks to our Patreon backers who make videos like this one possible. And if you want to see your name at the end of videos, then you too can back us on Patreon. The link to that's in the description.